Welcome to Behind the Beauty, the official North Texas Plastic Surgery podcast. I'm your host, Dr. Sacha Obaid, the founder of North Texas Plastic Surgery, and I have a really special guest for you. And I promise he won't put you to sleep while listening to this. Our own director of anesthesia, Dr. Maulik Parikh. Dr. Parikh grew up in the DC metropolitan Virginia area and attended the University of Virginia for both college and medical school. He then cavalierly chose to move down here. You see what I did there, right? So he then cavalierly chose to do his anesthesia training at Baylor in Houston at the Texas Medical Center.
That's right.
And then moved here to Dallas after that, and has been in private practice now for 17 years.
That's right.
Wow. And the 7 most important and best of those years right here at North Texas Plastic Surgery.
Yeah.
So thank you for joining us, Dr. Parikh.
Thank you so much for having me. I really appreciate it. And it's nice to be able to talk like this. We get to talk in the operating room all the time.
Yeah, but you're usually behind the drape
That's
there.
Right.
You know
That's
what I mean?
Right. It's nice to see a little bit of Anesthesia Unmasked.
I like that. Anesthesia Unmasked.
But thank you so much for having me. I really appreciate it.
Well, thank you for being on. And I think you're kind of diving right into it in terms of unmasking the whole process of anesthesia.
That's right.
So probably the very first question that we get is, am I going to be asleep for surgery? And so Dr. Parikh, what's the answer to that? And what does asleep for surgery actually mean?
Perfect. Love it. Yes, you're going to be asleep for surgery. And yes, you're going to stay asleep for surgery.
That was my next question.
That's the question that I get asked all the time. And yes, you're going to wake up from anesthesia.
Afterwards,
but
not in the
third
middle of it.
question. That's right.
Yes, all right. First one, go ahead.
That's a great question. Absolutely, there are different levels of anesthesia, which most people don't understand, and that's not their fault. They're just told by friends and neighbors and family members, "I had anesthesia." You can have something as simple as local anesthesia, which is something you might have if you cut your finger and go to the ER. They'll tell you that they're going to use a local anesthetic to sew that up. Most often for people have the next level of anesthesia, which is some sort of sedation. And that's most commonly used for things like colonoscopies, or if you've had dental work, if you've had wisdom teeth, if you've had a root canal, anything like that would be some level of sedation, but not actually general anesthesia. So general anesthesia is sort of the highest level of anesthesia that you can have. I'll add one caveat.
We're flying first class.
That's it.
Okay,
there we go. Sleep with the best.
There you go.
So I'll tell you, I'll add one caveat. A lot of patients, tell us that I've had anesthesia before, and that's usually during childbirth. Or, at some point during either they had a C-section or they had an epidural during childbirth. That is also a form of anesthesia, but it's not general anesthesia. So a lot of patients come and tell us, I've had anesthesia before, no problems. And we'll always differentiate and say, okay, but if you had general anesthesia, which means were you completely asleep? So general anesthesia means you are actually unconscious, which brings up one of the questions that patients ask sometimes, like, am I going to remember it or am I going to dream during anesthesia? No, because you're actually unconscious. So to you, we can do a long surgery and it'll all feel about like it was 5 minutes to you. In fact, the most common question we get asked in the recovery room is, can we get started? Are we going to start? And we tell patients, we're all done. And they say, what time is it? How can we already be done? So that's what we're talking about when we talk about general anesthesia. One of the things that comes up a lot is, patients say, my neighbor had plastic surgery and they had it awake. They had awake lipo, or they call it laser lipo or light lipo. Why aren't you doing that here? It seems like if I can get away with not having to have anesthesia and go completely off to sleep, then why wouldn't I do that? One is we want to make sure that you are asleep and comfortable the whole time during surgery, number one. So, our first priority is safety. We want to make sure that everything we do is completely safe. We want to make sure that the patients are ready to have anesthesia and that the anesthetic itself is completely safe. And then the second thing, of course, is comfort. We want to make sure that you are totally comfortable having your surgery. And then the third thing is we want to make sure that our surgeons can do what they need to do to get you the absolute best result. So, these awake plastic surgery procedures are are okay, but they can't do what we can do when we've got a completely asleep and comfortable and safe patient.
Mm-hmm.
And so that's why we choose general anesthesia for 99% of our procedures.
And I think you hit on a real big key there. It's all about what kind of transformation you're looking for.
Right.
You come in and you've got just a little area this big on the side of your tummy tuck incision that, you had somewhere else. And you just need a little bit of lipo, 5-10 minutes of lipo. Yeah. Let's do it under local, or let's do it with a little bit of sedation. But when you start talking about, hey, I want you to completely transform my body, from shoulders down to my butt, then that's not something that can be done under local anesthesia. And, when people tell you local anesthesia, my sort of view on that is simple. Small anesthesia, small results. That's big right. Anesthesia, big results. So if you're looking for a little nip tuck little thing, fine. We'll do a little local with sedation. But you want to look like you did before the 3 babies, let's do it right. Let's put you to sleep.
Exactly. And then, that leads to the next question that we get asked a lot is, well, my neighbor had anesthesia, my girlfriend had anesthesia, and she said she woke up in the middle of it.
Yeah.
So, how do I know that's not going to happen to me? And that's most of the time we have to differentiate. And you'll find out once you get a little more of the story that they just had sedation. So sedation is exactly that. I think of it as asleep. When you're asleep at night, somebody can come make a noise or shake you and you'll wake up right up. That's a lot of what sedation is like. So that's not the same thing as general anesthesia. And that's not what we strive for, because we are looking for the major, massive, awesome transformation, right? Which is the only way we can really achieve that is through a true general anesthetic.
And, that's one of the frustrating things that I can tell you that I have as a plastic surgeon is that when patients come to me and they say, hey, I'm going to go have a BBL done awake somewhere else. And I just laugh, because the amount of fat that can be removed and transferred while you're awake is 5% of what I can do when you're asleep. And so if you're looking for a 5% result at 95% of the price, then
that's right.
Go ahead. But if you're looking for, 100% of the results, then we definitely want you to be asleep. And that allows us to really be aggressive, really transform you. And there is also this misnomer, Dr. Parikh, that, well, if I'm not fully asleep, it's safer.
Yeah.
Okay. And that is
one of my favorite topics. Thanks for bringing it up.
So go ahead and tell me. So tell me why, so I'm coming in, I'm going to have liposuction around my waist.
Sure.
They're going to put a little bit of fat in my buttocks. Why am I safer fully asleep as opposed to twilight sedation?
Perfect. So one of the things that differentiates sedation from general anesthesia is what control we have over your airway. Okay. So your ability to breathe. Usually when you have sedation, you'll just have a nasal cannula or you'll have a mask that's giving you some oxygen, but that's not a controlled airway. That's actually a very unsafe airway. You're safer being fully awake or fully asleep, because we have full control of your airway and we can make sure that you're breathing properly the entire time and that you're getting oxygen to all the important parts of your body that need it, like your organs and your brain and your entire body, that you would when you're normally awake. Think about it this way. When you are fully awake, you don't ever forget to breathe. Nobody ever forgets to breathe, right? And if you start to forget to breathe, your body will remind you and say, take a deep breath, take a deep breath. Same thing is, we want you to be either awake and fully awake, or we want you to be completely asleep with a true general anesthetic where we control your airway. Okay, so whether that's with a breathing tube that goes down into your trachea or a small soft device called a laryngeal mask airway, or LMA, that we place at the back of your throat, that gives us control of your airway. So you don't want to be halfway. Halfway is actually what leads to the unsafe outcomes, right? Or the
Right.
things that are very dangerous, because you're not fully in control of your reflexes and your ability to breathe, and we're not fully in control of your reflexes and ability to breathe. So that's a terrible combo. When you hear about bad outcomes in plastic surgery, often that's the situation. Patients are unaware. They're just told, you're going to have anesthesia.
Mm-hmm.
Nobody sits down and takes the time to explain to them that, hey, you're just going to have sedation. And then that brings up, you should know who's controlling things in
Yes.
that operating room environment, right?
Yes.
Who's in charge of the sedation?
Yes.
Is it an anesthesiologist or a certified registered nurse anesthetist like we have? Or is it somebody that was just trained a little bit on sedation but doesn't really feel comfortable with the airway?
Mm-hmm.
We're the airway experts, and that's why. And that's why you really want to make sure.
Yeah, and I love that you mentioned that, because that's one of my sort of personal pet peeves, right? As a plastic surgeon, nothing drives me more crazy than the guy or girl who goes to the weekend course on plastic surgery, and they feel like now they can do liposuction or a breast augmentation, even though it took me years to learn it. I guess I'm not that smart, but whatever, right? It's the same thing. It's funny because as plastic surgeons, we all that concept drives us insane. And yet many of us are arrogant enough to think, oh, well, I went to the weekend course on anesthesia, so I'm going to do the anesthesia, save some money.
That's right. Unfortunately,
while I'm operating. So first off, I'm not an anesthesiologist. Secondly, I sure as hell am not good enough at anesthesia to do it while I'm operating.
Right, exactly. And that's exactly it. Actually, check out the podcast you did on medicine's dirty little secret, right?
Yes.
And it's exactly that. It's that unfortunately in America, advertising goes very far and marketing goes very far, and you don't actually know. So what ends up happening is, like you said, you have somebody that's not really trained in plastic surgery that's doing cosmetic surgery,
Mm-hmm.
right? And you don't want that. Not
Right.
when you're having this life-transforming surgery, which
Mm-hmm.
oftentimes you're going to have once or twice in your lifetime. That's it, right? It's
Right.
it's a true makeover. We call them mommy makeovers for
Yep.
a reason, right? You want it done right, and you want it done safe. Sacha and I rarely butt heads about things. We're usually on board.
Yeah.
Other than sports, we usually don't butt heads about things. But one of the things that we've discussed a lot in the past is patient safety.
Yeah.
And fortunately, we are on the same page when it comes to patient safety. We got to be safe. That comes first.
Absolutely.
Right.
And, back to that question, when you talk about the twilight sedation and we talk about the control of the airway, what people don't realize is with the airway, things can go wrong in a matter of seconds,
Right.
Not minutes, not hours, seconds. Literally, you can lose an airway in just a few seconds, and it is the equivalent of choking, suffocating, drowning. Okay. Just a few seconds can be life and death. And so the reason why having control of that airway is so important is when we start talking about doing twilight sedation, in other words, giving you so much medicine that you can't remember what's going on while we're cutting on you, sucking your fat, etc. All right. But, at the same time, we're not controlling your airway. Well, if we got you that sedated, you can lose that airway either because you throw up and then swallow that into your lungs, or because that sedation becomes so strong because of a very tight window of titration of the medicine that you actually stop breathing. And when that happens, it literally is seconds between life and death. And the problem is now you are upside down. Someone's trying to do your BBL. No one's got their eyeballs on your airway. The surgeon is working his or her magic down on your buttocks. They're not paying attention to it. It's a recipe for disaster.
Right.
Okay. Conversely, Dr. Parikh or one of our other anesthesia team members who's fully trained in that before they let me even put my gown and gloves on, they have that airway secure.
Yeah.
100%. So we're not going to lose it. We're not going to have a problem.
And the one thing I would add is that unfortunately, a lot of the facilities where you'll go to where they're just doing sedation, where they can actually lose the airway,
Yes.
they don't have anybody that's an airway expert there to fix that problem if it were to happen.
Yeah.
So you've just taken something bad and then you've added something much worse on top of it.
Yes.
And then it just leads to a disaster, right?
Yes.
And we like boring. We
Yes.
like safe and boring is awesome,
Yes.
right?
Yes.
We don't want any excitement in that way. So,
and that's also important, right? When you talk about the facility, what is the room that you're having surgery in? Is it a fully accredited operating room by Quad ASF or JACO? Those are the two big accrediting bodies, okay? Or is it in somebody's back room in the back of their office, right? We don't want that. We want to have every single piece of equipment there that we need. Not only the anesthesia machines and the ventilators, all those things, but also things like glide scopes, I think you call them. Or
yeah, we have advanced airway
Sorry,
equipment. We have we have wall suction, which is different than just portable suction that you see in a lot of facilities. So, what I like to think of it as this. It's nice to be able to have plastic surgery outside of a hospital. It's not a big, scary, maze of hallways and big parking decks. So it's nice to be able to come to a smaller facility that is comfortable, that's pretty, it's beautiful, aesthetically pleasing. But when we cross that doorway and we get into the clinical side, we like to be like hospitals. We're well prepared. We're accredited appropriately. We have all the training and the proper safety equipment. And that's what we want. We want it to look like a nice, wonderful waiting room. But then when we get to the clinical side, we want it to be totally professional.
Absolutely.
And it should be sort of big and hospital scary, but that's a good thing. We want to be, totally prepared. And we are. And that's something that I really appreciate. I've done 17 years of anesthesia, and believe me, I've done anesthesia in major medical centers. And I've also done anesthesia where we were doing sedation in someone's office, let's say, not for plastic surgery, but for other procedures. And it's awesome. It's nice for us when we get to sit in a facility that, you and I have worked hard on making sure that that facility is perfectly safe and we have all the right things that we need. So God forbid there is some sort of a, problem. We know how to handle it, and we take the problem, fix the problem, and everything's great.
And you actually said something that I think is really important. One of the big, I believe, advances that we've made at North Texas Plastic Surgery is having a full-time director of anesthesia on staff, because Dr. Parikh is involved in every part of what we do from jump. So he's involved in setting everything up for the ORs to make sure that we have the equipment that he needs and his team needs to have a successful, safe outcome from the surgery. And I think that that's important, because one of the things that I would assume is stressful as an anesthesiologist is you're often in other places, not with us, but you're kind of traveling from one center to another center day by day by day.
That's right.
You never know what's going to be there.
That's right.
But here you've set it up so that every single thing, where it is, you're ready to go, etc.
Well, I've set it up, and I'm fortunate enough to be able to be there every day. So I don't have to go traveling around to an unfamiliar place where I don't know the staff, I don't know the equipment. I get to come to the same place and do surgery every day with surgeons that I know. And I know, and that's important too, because I know how the surgeons work. I know how they approach each surgery. And I get to work at the same place where I know where everything is, and we've helped set it up. So it's done right. And it's nice. We have full-time staff that's there every day.
And it makes such a big difference for me as a surgeon too, because the physiology changes to a T that I'm going to create when we do a mommy makeover with tummy tuck, lipo 360, BBL, etc. And so you then titrate the medicines, pain medicines, the fluids, the anesthesia, etc., so that the patient wakes up exactly how we want them to wake up. And that allows me to never think about it. I can't tell you how important that is for the patients, because as a plastic surgeon, even when I was employing an anesthesia company that would send various anesthesiologists to my facility, or we would go to various hospitals, I had to devote a significant portion of my brain power during the operation towards making sure the anesthetic was being delivered the way I wanted it and the way that was necessary for the physiologic changes I was about to create. But now it's all on autopilot because I know you're there and you know exactly what's going to happen.
Yeah.
And so it's easy. And I think it's also one step further. One of the unique things that we do at North Texas Plastic Surgery is Dr. Parikh actually does the pre-op clearances. And I know that this is always kind of a thing that drives patients crazy when we ask for X, Y, or Z, but why is pre-op clearance so important? And why are you involved in that?
Sure. So, I mean, great question. My favorite thing is when patients say, oh, it's just plastic surgery, right? And we like to think of it as plastic surgery is fun, happy surgery. And we love that, right? But patients always say, it's just plastic surgery. Why do I need all this blood work? And why do you want to talk to my primary care doctor or my cardiologist? And this is what I always tell patients. It may be just plastic surgery, but for most patients, it's the biggest surgery you're going to have in your lifetime, right?
Mm-hmm.
I hope you don't have lots of surgeries that are, much longer than the surgeries that we do. We don't do very complicated surgeries, but they're definitely longer.
I want to interject there. That it's quite complicated.
Yeah, there you go. There you go.
Go ahead.
Yeah.
I'm just kidding.
No, these aren't heart transplants, right? But they are. But we take them seriously as if they were. So here's what happens. Whenever you're going to have plastic surgery, it's truly elective surgery, right? You can go patients may not feel that way. They may feel like they really need to have a breast dog, but you can go your entire lifetime and not have one. We don't want you to. We don't want that. Yeah, I was going to say, we don't want that.
We're not advocating that.
But you can, right? And so it's truly elective surgery. So what that means is that we want to make sure that the patient is completely what we call optimized for surgery, okay, ready to have surgery. Fortunately, most of our patients are healthy. On top of that, most of our patients are young and healthy. Some of them don't even see a doctor on a regular basis. So it is a little irritating when we tell them, we need to go see a primary care doctor. We need to make sure that everything's okay. We need you to order blood work or get an EKG. And patients will say, I'm fine. I'm healthy. I work out all the time. Why do you need me to do these things? We want to make sure that you're totally optimized and ready for surgery. Okay. So part of what that means is we're going to make sure that we have a good handle of where you're starting as a baseline from your blood work, your EKG, what medications you take and why you take them, right? Oftentimes it's funny. We'll uncover something, patient will talk about a medication they're on, and they're not completely sure why they got put on it. And so it's a good time for us to ask, right? Have you had any anesthesia complications? Have you had general anesthesia before? Like I said, a lot of our patients come to us and said, I had an epidural. I've never had general anesthesia. So we want to know about that. We want to make sure that you're optimized before you have surgery, because you are going to have a big surgery and then you're going to have a big recovery from that surgery. So it's almost like stretching before you run, right? If you go try to run a marathon and you don't stretch before, it's going to go badly.
You're hamstring.
You're going to hurt yourself, or you're just going to feel terrible. But if you've trained for it and if you're properly set up for it, then you can have a great run and you're not going to be as sore after, et cetera. So we work on all of those things. So one of the things that we do is, whether I'm involved in your anesthetic or you have one of our other anesthesia team members that actually performs your anesthetic, I do get to see every single pre-op piece of information. So all those annoying labs we made you run around and get, or, the notes, the medical release, so we can get the notes from your last cardiologist appointment, those do get looked at and they get examined to make sure that we're ready for surgery. It doesn't happen often, but every once in a while we do tell patients, listen, we absolutely are going to do this surgery for you. You are going to have an awesome result, but not today. We're going to push it. We're going to push it 6 weeks. Let's get this diabetes under control. Let's get your thyroid under control. Let's get whatever it may be.
Mm-hmm.
And then you come back and then we'll be ready to go. And you'll be totally optimized for surgery and ready to go.
Yep.
So that's the pre-op testing piece of it.
And what's really nice is that having you involved with that ahead of time makes it so that there's not a surprise on the morning of, because I got to tell you, nothing is more frustrating, not just to the surgeon, but to the patients especially, than they show up on the morning of, they're meeting the anesthesia provider for the first time, and that anesthesia provider has never looked over the patient's history. And so they get there, then they have all of these questions, and then they get into the situation of, okay, the anesthesia provider feels like maybe things aren't 100, and they have to decide, should they proceed with the surgery, makes the surgeon and the patient initially happy, not happy later, but initially happy, or are they the bearer of bad news and they say, hey, we have to go, we've got to go look at this a little bit deeper, and then the patient's surgery gets canceled, even though they've arranged the time off from work, the coverage for their kids, et cetera, et cetera, et cetera. So both of these things are terrible, and it puts the anesthesia provider in a real bind. But having Dr. Parikh review everything ahead of time for all of the patients means that it's very, 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 very rare that we run into a situation like that. And so I think that's super, super helpful. And it's also helpful because one of the other challenges that we run into, quite frankly, is there are so many medicines and supplements that are out there that have anesthesia side effects that, while I wish I knew them all as a plastic surgeon, I certainly don't. That's not my field of expertise. And all of my weekend courses on that don't cover that. Yeah. And so, it's great to have someone who is an expert in that field, reads the journals all the time, et cetera, reviewing those lists of medicines, supplements, et cetera, and then making a decision on what we need to stop ahead of time. Because a lot of times those things are safe, right? But you just need to stop them 2 weeks ahead of time or a week ahead of time.
Right. So yeah, that's great. I mean, let's actually talk about, so one of the things that we'll do is we'll review the medicines that you're on. We're obviously not going to stop medications like blood pressure medication.
Sure.
It's very important. You need to take it. But let's talk about two categories of medicines where this comes up, and it leads to a lot of patient frustration, right? Mm-hmm. Please know that, in all the things that we do, there's a reason we do them. We're not we're not stopping your meds to just torture you. There's a method behind each.
I can't function without my ADHD meds.
Well, right? That's right. That's right. I'm not sure they're working because you're pretty all over the place anyway.
Just to be clear, I'm not on that, but that is one of the most common things I hear.
No, right.
That and my hormones.
Well, I was going to say, yeah, exactly. So, we get asked questions like, for example, hormones is a perfect one. Patients, they take hormone pellets. They love the way the pellets make them feel. And they're happier in general and feel better when they're on them. And then we ask them to stop them, 4 to 6 weeks before, let's say. And the patients say, come on, man, really? You want me to stop these meds 6 weeks before and I'm going to be miserable during that time? So here's the reason why, in particular for hormones. A lot of those types of hormone type medications, those pellet formulations, they're not necessarily FDA regulated. This applies to supplements. We have this huge problem with, we have a huge healthy population in general, and people love working out and they love pre-workout and they love random supplements that really help them. Those are not FDA regulated. What that means is that we don't always know what's in them. So unfortunately, the bottle can say creatine, but we don't know what else is in there. Not like the other medications that you take that are FDA regulated. When you get a bottle of Tylenol, it's acetaminophen. It's Tylenol. Yeah. There's nothing else that can be in there.
And it's tested by a third party.
Nothing else can be in there.
Exactly.
So that's one of the reasons that we'll ask you to stop things like hormones or other supplements. And that's a huge source of frustration for patients. Another one, talking about, trends and
and actually before you jump too far ahead, I want to also point one thing out on the hormones. And when we talk about hormones, that also specifically, it does include the birth control pill. One of the things from our end is when we talk about the estrogens specifically, it really does increase your risk of blood clots. And blood clots are the most, or one of the most dangerous parts of any surgery, whether it's plastic surgery or any other surgery. So what happens is you're asleep for surgery, the blood vessels open up, the blood pools in your legs. That can cause the blood clots. And you say, what's the big deal with that? Well, that blood clot can travel from your leg to your heart and your lungs and can have really bad complications. And so stopping that hormone replacement therapy, stopping those oral contraceptives can really make a big difference from a safety perspective from our end as well. I'm sorry, go ahead. You were going to talk about.
Oh, I was going to talk about, the weight loss drugs,
Yes.
Ozempic and the like. That's something that those drugs didn't really exist a couple of years ago,
Yeah.
right? And they've come on the scene and everybody's taking them. And we'll ask patients to stop them 2 weeks before. And patients are a little confused and say, well, isn't it good? I should continue this weight loss drug. It's working well for me. Why are you asking me to stop? And that is really a specific anesthesia thing. So one of the ways that those medications work is they actually keep your stomach fuller longer with food actually sitting in your stomach. So when your stomach is full, that's something that we want to avoid before you have anesthesia, because like you talked about, that food can, while you're under anesthesia and unconscious, that food can travel up and end up in your lungs. And that would be the worst thing. And we don't want that to happen. So we make sure and stop it 2 weeks before so that we can be sure that your stomach is empty. Which brings me to the other big frustrating thing is we say nothing to eat or drink for 12 hours before surgery. And you'll hear the term NPO. And NPO is Latin for nil per os, which basically means nothing by mouth. And, patients will say, why do you do this to me? I just want to drink some water. How bad can water be? Same idea. Okay. We have to make sure that your stomach is completely empty so that when we are managing your airway and placing a breathing tube, that those stomach contents don't come up. And by the way, nothing per mouth means nothing per mouth. So no chewing gum. You cannot brush your teeth the morning of. All of those things are actually bad. Brushing your teeth actually causes you to produce a lot of saliva, which all ends up in your stomach, and which is what we.
I'm glad that you went with brushing your teeth, because I was a little afraid with my viewers that nothing by mouth might be taken somewhere else.
Different direction. Yeah, that's right. Brushing your teeth. No gum, no brushing your teeth, and no food or drink for 12 hours. So again, there's a reason behind each one of these things that we do.
One other med that is that we started talking about that I want to circle back to, because it's one that I get a lot, is, Dr. Parikh, listen, I'm a mess at work if I can't take my ADHD meds.
Sure.
So why do I got to stop that before surgery? Who cares?
Sure. ADHD meds are, very effective, and they're very, very prevalent in our population. They're also one of the most dangerous drugs when it comes to anesthesia and your intraoperative time. So the way ADHD drugs work, they're actually a stimulant, which sounds backwards because they're, helping people to focus and maybe calm them down a little bit. But that's the way the medicine works. And what happens is, especially when you're on those ADHD meds for a long,
it stimulates the part of your brain that helps you focus.
Yes, exactly.
Sorry.
And when you're on them for a long period of time, one of the things that happens is it depletes certain chemicals in your brain because they're always being released or stimulated. And so it can lead to wild swings in your blood pressure and heart rate when you're in the operating room. And that's really one of the frustrating ones. We had a patient recently who was a student who said, look, you're asking me to stop this medication for a week and I've got exams, I've got to study, I can't do it. And, that was one where I had to be a little more adamant and say, no, I'm sorry, we really need you to stop it, because it can be very dangerous intraop. And these are things that people just don't know. And I understand their frustration when they say, I don't understand why. You're asking me not to drink water? You're asking me to stop this medicine that helps me so much? Why? And these are the reasons why. So
I love it. So last thing, before I let you go, Dr. Parikh, I do want to clarify is, we've talked about stopping all of these meds ahead of time. We've talked about stopping the supplements, et cetera, and not taking anything by mouth. But there actually is a little asterisk, which is there are some things we do want you to take on the morning of, and we do want you to take by mouth before you come in. So can you tell me a little bit about the specific classes of drugs that you really want us to make sure that our patients are taking on the morning of, despite that NPO order?
Absolutely. So, we'll start with the major ones. So blood pressure medications. It's important to take your blood pressure medicine. If you're diabetic, it's important to take your diabetes medications. If you take anything for your heart, it's important to take those medicines. We don't want to mess with medications that are that critical and important. Okay. Mm-hmm. We also want you to be your normal baseline self. That's what we're looking for, mm-hmm. right? So, patients will tell us sometimes, I'm going to not do this one thing I always do before surgery. No, do the things that you normally do. We want you to be your normal self. Mm-hmm. We just want you to sort of be the best version of yourself before you have surgery. So, all those types of medications, and our nurses go through this with you specifically, patient to patient, about which medicines we want you to stop, which ones we want you to take. For the most part, we're going to have you take your medicines, allergy medicines, in North Texas, asthma medications, things like that. We're going to have you continue. There's a few exceptions, but we can go over those one by one, each patient at a time. But in general, we're going to have you take most of those medicines. And then if you don't mind, let's talk real quick about, we're going to even really confuse you, because then we're going to tell you nothing by mouth. And then when you get to our center, we're going to give you a few medicines with a little sip of water, which is super confusing. Yes. Patients get very confused by this. So one of the things that we try to do with anesthesia is that, our job is to make sure, like I said, safe and comfortable. So we want to make sure and get a good control over pain, both preoperatively, intraoperatively, and postoperatively. Mm-hmm. So one of the things that we do preoperatively, we found that there's certain pain medications that we can give you right before surgery. Celebrex is one, Tylenol is one, gabapentin is one, that when taken right before surgery helps to control postoperative pain a lot. So you have a much better immediate post-op recovery period. And so we'll confuse you by giving you a tiny little sip of water and those meds right before surgery. And the timing of those surgeries is important.
And it's like everything else in life, right? If we can get ahead of things, it goes smoother. So if we can start controlling the pain before you actually have any, we're going to get better control overall.
That's right.
Dr. Parikh, or Parikh Star, I should say, we could talk about this for hours, but I know our listeners have a lot of other things they got to get done today. Thank you so much for your time. Thank you for all that you do for us at North Texas Plastic Surgery. We're very appreciative. And thank you all for tuning in. I'm Dr. Sacha Obaid, and this is Dr. Maulik Parikh, aka Parikh Star.
Thanks for having me. I really appreciate it.
Saying thank you. Tune in next time. Like, link, subscribe, do all the things. Thanks.